Today we're talking all about the new hottest filler. It's Profhilo / Profhilo. Hello, welcome back to the channel. I'm going to be talking about Profhilo / Profhilo today. I really do need to get a bit more clarity on how one is supposed to pronounce that. For the remainder of the video, I'm going to say Profhilo because that is my preference. This product has been around for some time now. I remember first getting it maybe around 2.5 years ago, if my memory is not completely wrong. I remember seeing it at one of the trade shows and thinking, wow, that looks amazing. That's definitely going to fill a gap. And which is kind of funny because that's sort of what it does. It's a hyaluronic acid, which is not cross-linked in the usual way, as in with BDDE. So a regular hyaluronic acid will have links in between the chains of hyaluronic acid of BDDE, forming a sort of lattice work. And it's this property which, when you inject it into the skin, stops you from absorbing it super quickly. So Profhilo is a little bit different because it doesn't have these crosslinks between the chains. Instead, it's heat treated and it has weak forces of electrostatic attraction between the chains, which kind of holds it all together. The whole point of using Profhilo is not to give you a volume change. It's more of a biostimulator. So when you inject it, first of all, it holds water into the skin. And second of all, it causes your skin to produce a little bit more collagen next to where it's been injected. What does this mean for you? Well, it improves the skin surface texture, makes it look a little bit more even, a little bit more luminous, and a little bit more dewy. The manufacturers of Profhilo usually recommend 2 treatments, which are performed 1 month apart, and then we will typically do 1 more treatment after around 3 to 6 months. There can be a tiny little bit of downtime with this, as there is a small bleb left on the skin for, I would say, around 12 to 24 hours, which slowly disappears as the product dissipates through the skin. There is a standard injection pattern of doing 5 points on each side of the face, which does help to give a tiny little bit of lift in certain key areas and a tiny bit of a boost. When we're treating areas such as the neck, obviously we don't follow the same pattern. We just tend to go with whatever presents well in that area. So I have my own personal technique. I'm sure that there are other doctors out there who are maybe doing something slightly different. You can use a cannula to inject Profhilo. It's my preference not to, because I find that my patients at least find it a little bit uncomfortable. There is no local anesthetic inside Profhilo, so it stings for about 90 seconds after you've had the injection done. This is totally normal. Don't freak out, it goes away. Do you need to have topical anesthetic before this product? Not really, no, because it's super quick. Literally 5 injections, as I've said, on each side of the face. It really is not worth hanging around for half an hour with topical anesthetic on the face for. And in any case, it's the hydrostatic pressure where the product pushes the tissue apart that really gives the sting, not the needle point insertion. So all that sounds pretty great, I am sure you will agree, but what does it look like? Well, it's kind of annoying because often when you're doing the face, you can't really truly see skin textural changes. At least not in the video format where we take our pictures from anyway. There are some very slight differences in the images, which I'm going to show you in a sec, but it's probably something that you see more in real life than on a 2D picture. First of all, let's see how the injections are done. So let's go over to our first patient today, and you can see that she's just having this sort of standard 5 injection point pattern. What's really interesting about Profhilo is people are having it done at various different age points. So in the patients that we've got today, we have some that are very young and some who are more mature. So in the before and afters that I'm about to show you, all these patients have only had 1 session, and this is 5 weeks after that 1 session. No doubt we would see a greater improvement had they had more than 1, and had we have used a different method of capturing the images. So this is our youngest patient from the shoot. She does have her head at a slightly different angle, which is kind of interesting because I suppose it allows us to show what a difference having a different head angle can make to these things. But really what we're looking at is her skin quality and her skin texture. So I would say definitely looking a bit more glowy in the after picture. And remember guys, this is just after one treatment. Next up, again, just one session, before and after, 5 weeks after the session was done. I guess you could argue that there is a little bit more light reflex in the cheek area here, but this is about normal. Third patient now, same treatment. This is kind of interesting because in some patients, they do have a really good response to Profhilo, and you will see that they get a little bit of lifting in the tissue, and I think that that's probably happened to her. So the shape of the face does look a little bit more contoured. So that can happen even just after one session, but response is variable. Final patient, we did do a little bit more for her. So she had double dose of Profhilo and also a treatment called Bioexpander by a company called Regenial in the mid-face in this area here. So she has had a bit more treatment, but again, only with these biostimulating products. And that's just because she did have a lot more tissue descent than the other patients and was just generally looking a little bit heavier. She needed it basically. So I think in the after picture you can see that she does have a little bit more plumpness and volume in the cheeks, which is pretty normal for the amount of product that we've put in there. So she had a total of 7 mils of biostimulator. Well guys, that is it. It's the end of an era. I'm not cancelling the channel. No, don't worry. Actually, what's happening is I'm completely changing how we do these Friday videos. So there will be a slight hiatus of about 4 weeks where I'm going to be talking about different topics, and we're not going to have any patients being shown. But then after that, I'm coming back at you hard with a new format with better before and after pictures, because I got a flashy new way to do it, and the videos are going to be a lot more in depth than they currently are. We're going to be really digging deep into why people do these certain procedures and why I make certain suggestions. Because they're going to be a bit more in depth, they will be every other week instead of every week, but don't worry, I'm going to fill that Friday slot with something so you won't be left wanting. If you have any comments, suggestions, anything that you'd like to see, either in that hiatus or on the alternate Fridays, let me know in the comment section below and I will do my utmost to accommodate you. In the meantime, please don't forget to subscribe to the channel and like the video if you enjoyed it. I will see you here next week. Bye bye.